Good afternoon, County Executive Rich Fitzgerald. I'm going to take my mask off just to speak. We're very socially distant in here, but we got some requests that people couldn't read lips, and not everyone knows signing that Danielle does every week. Here with Dr. Deborah Bogan, the Director of the Allegheny County Health Department, here to give the weekly update on where we are. We know for the next few weeks some of the orders that have been put in place by Governor Wolf and Secretary Levine to try to keep us safe. We know these numbers continue to be alarming with positivity rate, tests, hospitalizations, fatalities, etc. continue to be not what we need them to be. Obviously, as we get through the holiday season, we really need people to limit the gatherings. Many of it's not going to happen at the official places of business. It's going to happen in people's individual homes. So we really ask you to listen to the advice of our medical experts who are doing everything we can to keep us safe. The good news is there was beginning this week a distribution of a vaccine. And that's the light at the end of the tunnel we've all been looking for and hoping for these last number of months. The Pfizer vaccine has begun to be distributed at many of our hospitals in and around Western Pennsylvania, throughout the state and throughout the country. We're hoping that the Moderna, and we're expecting that the Moderna vaccine will also get emergency authorization from the FDA tomorrow or Friday. And then next week, that would be another source of vaccine. And Dr. Bogan is going to talk about the plans that are being put in place at all levels to try to make sure that we get as many people vaccinated as quickly as we can and as safely as we can. So with that, one last thing. Now, we know how powerful and important Dr. Bogan is. The truth of the rumor that she ordered up 4 inches of snow for us to stay home is absolutely not true. But it does give us one more good reason for people to stay home, to stay safe on the roads as well as in COVID. Dr. Bogan.
Good afternoon, and thank you again for joining us. Today, I want to briefly review our latest county data and then spend most of my time talking about COVID-19 vaccine and answer questions that have been coming into the health department. The current Allegheny County 7-day rolling average case count is about 1,000 cases per day. This is an increase from last week of about 150 cases per day. And our county's positivity rate for PCR tests, according to the state, is 14.6%, a 2% increase from last week's numbers. Curative Inc., the company the health department hired for testing at our federally qualified health centers, at our McKeesport test site, and at mobile locations around the county, has been testing at record levels. Recently, about a third of all the tests being done in the county have been done through Curative. On many days, they've tested over 1,000 people a day, and since November 1st, they've tested about 30,000 people, and about 30% of those have self-identified as people of color. As for hospitalizations, admissions continue to climb, but at a slightly lower rate of rise. For the week of November 25th to December 5th, about 220 Allegheny County residents were admitted to county hospitals, compared to about 200 the week before. This surge continues to put strain on our hospital staff and our healthcare resources. And so far this month, already 94 people have died, a trend that will make December the deadliest month yet here in Allegheny County. Of those who died this month, 16 were under the age of 65, which represents a third of the deaths in that age group since March. I again extend my deep condolences to everyone who has lost someone during this pandemic, and I truly look forward to a briefing in the near future when we no longer have COVID deaths to report. But sadly, I do anticipate that hospitalizations and deaths will continue to climb until we start to see the impact of the state's mitigation measures. But we also know that mitigation measures really work. And if followed, they will start to bring down the cases around the end of the year. These safety measures put in place by the state are only effective if people follow them. Since the new orders, the health department has received about 250 complaints about businesses not following the orders. And a few businesses have received many complaints. The health department is one of many agencies tasked with enforcing COVID mitigation measures. We use our COVID field response team and our food safety inspectors to help food facilities follow the rules and to enforce the new orders if they aren't complying. We call other businesses and work with them to strengthen their safety procedures. The Pennsylvania State Police, Liquor Control Board, and the State Departments of Agriculture, Health, and State have also been tasked with enforcing these rules, and so have local police. But enforcement can be challenging. As the health department, our inspectors do not have the authority to shut down a business and padlock its doors immediately. Our inspectors can order a business to close and suspend its operating permit, but if a business refuses to comply with that order, the health department may work through the courts for further enforcement. State and local authorities have limited resources too, and we can't constantly watch or monitor every restaurant, every gym, every gathering or event to make sure that people are following the rules. That's why we are relying on all of you. We are relying on business owners to do the right thing. Not complying with these mitigation steps not only puts your business at risk, you could be ordered to close, face fines, lose liquor licenses or permits, but it puts at risk the lives of your customers and your community. We rely on you residents to patronize and support businesses that follow the rules and shun those that do not. And I'm relying on you to make safe decisions as you celebrate the upcoming holidays. Please don't travel, don't have large holiday parties. If you are gathering with people who don't live with you, do so outside while wearing masks. I know that at least one member of my staff plans to exchange gifts with his in-laws outside around a campfire this year. I hope he has a lot of fun. This year is going to be different, but by being different now, we have a chance to make things normal again next year. So let me turn my attention to COVID vaccines. It was really exciting to watch some of our healthcare workers get the first doses of vaccine this week. This is the beginning of the end of the pandemic and a bright light at the end of this long, dark tunnel. As you likely have seen on the news, the first shipments of vaccine were sent directly from Pfizer to hospitals so they can vaccinate their highest risk workers. By the end of the year, CVS and Walgreens will begin working to vaccinate some of our most vulnerable residents living in long-term care facilities. We do not yet have a definitive date when we will receive COVID-19 vaccine in the health department. But when we do, it will be small amounts, and we will follow the State Department of Health's prioritization guidelines for who gets these early vaccines. That means most of the health department vaccines will go to healthcare workers on the front lines who are not affiliated with one of the hospitals in the county. Please be patient as our county vaccine distribution plans firm up. You can expect that as the supply of vaccine increases in the coming months, we will have community-based clinics and that hosts of providers will be offering vaccines, including community pharmacies, federally qualified health centers, doctors' offices, universities, large employers, and many others. Please know that the health department is working closely with county government, municipalities, and many community partners to ensure that vaccines will be accessible to all who desire them in all the communities in the county and to those who are most in need first. Before I end, I do want to answer some questions that have been coming into the health department pretty regularly. So the first is the vaccine safe? Are the vaccines safe? So the FDA approved the Pfizer vaccine last week and will likely approve Moderna vaccine this week. The data from the clinical trials for these two vaccines support their safety. Since its release in England, Canada, and the US last week, the Pfizer vaccine has already been given to tens of thousands of individuals, and that experience so far confirms the safety. And there are robust plans in place to continue to monitor safety. Next question, was the vaccine rushed? So although the vaccines were developed quickly, they were developed using existing technology that has been used to develop other vaccines. They were also given unprecedented financial support that allowed them to be developed quickly without cutting corners. Will the vaccine make you sick? When you are exposed to a virus, like the viruses that cause the common cold or influenza, your immune system responds. The symptoms you experience, like body aches, fever, congestion, these are actually caused by your immune system's response to that virus. Similarly, when you get a vaccine, the goal is to boost your immune system. And when that happens, you get some symptoms of illness. So for instance, when I participated in the Moderna vaccine trial, I got symptoms after the second shot. And I was really glad about that because it showed me that my immune system was responding to the vaccine. And it also told me that I likely got the vaccine and not placebo. According to the FDA, the most common side effects from the Pfizer vaccine are pain, redness, or swelling where the shot was given, fatigue, headaches, chills, muscle pain, and joint pain. These symptoms typically resolve in 1 to 2 days. Does the vaccine give you COVID? We've heard that a lot. Absolutely not. The vaccine does not give you COVID. It protects you from getting COVID. It can cause you, like we said, to not feel well for a day or two, but that's not giving you COVID. That's your immune response. I've already had COVID-19. Do I need the vaccine? So people who had COVID-19, we think have about 3 months of protection from reinfection. So if you had a recent infection, you can likely wait to get the vaccine. Frontline workers who have not had COVID-19 in the past 3 months may be given priority for the vaccine. However, eventually, even those who had COVID-19 should get the vaccine. When will it be available to everyone? I anticipate that it will take at least a few months to vaccinate all those who want to be vaccinated in what we call phases 1A and B. And I hope by early spring we are vaccinating those who fall into phase 2, and by early summer, the general population. Last question, who shouldn't or who can't get the vaccine? Right now, the Pfizer vaccine is approved for ages 16 and older without any absolute contraindications. A number of organizations have put out guidance for pregnant and lactating women, and I refer you to those for more detail. This is an exciting time, and I urge everyone to get the vaccine, but to be patient while they wait their turn so that the most at risk and most in need can get it first. Continuing my record of incredible sports puns, the vaccine is our opportunity to go on the offense against COVID-19. Please stay home with your household member, and when you go out, please wear a mask that's properly fitted. And if you're going on the roads tonight, please be very, very safe. So please stay safe and be kind. Thank you.
The first question is from Public Source. Can you talk a little bit about the biggest challenge to provide the COVID-19 vaccine to homebound patients? Are you looking at programs that go directly to them, and how will you be getting out that information and that vaccine to those individuals that are homebound?
So we are, as I said, we are working on our plans in the county. That group of people who are homebound are part of our considerations. As those plans firm up, we'll be sure to let you know.
This next question is from the Post-Gazette. You talked a little bit about what actions the county can take against businesses, but have there been any actions taken since the new measures went into effect?
We continue to do inspections. We continue to post those inspection reports on our website. And our teams have been really busy working through the complaints and responding to them.
This next question is from the Philadelphia Inquirer. Would you attribute the mounting death count to a general wider community spread in Allegheny County, or are there any specific instances or events that you would credit with those numbers, like a nursing home outbreak or large Thanksgiving gatherings?
So I think, again, there is much more widespread community spread, so certainly that's part of it. Philadelphia has put into place a few weeks before we did any mitigation effects, and I think they're already seeing the benefit of those. So again, mitigation effects work. And we continue to see outbreaks in long-term care, but again, they haven't been increasing in the proportion of cases. So I do think this is really more general, widespread cases in our community.
since you referenced Philadelphia, I'm going to go back to a Post-Gazette question as well. Based on state data from the past week, it looks like the Allegheny County had the highest daily case total of any county every day, except for on last Monday. Do you believe that that can be attributed to Philadelphia shutting down indoor dining last month because they are obviously the next largest county?
Largest county, and truthfully, we're not that much smaller by population than Philadelphia. But Philadelphia put in mitigation orders a couple of weeks before we did, and they saw their cases at least steady out and go up at much lower rates than we did, and we continue to climb. And so I think that, again, it demonstrates that the mitigation orders do work and are effective, and I hope we'll see the same impact here in the next couple of weeks.
This next question is from the Tribune Review. Does the county have any specific metrics to show how gyms and high school extracurricular activities may have contributed to the spread of COVID, or any data on how many outbreaks or number of cases that could be traced back to those activities? We have been doing case investigations for a long time, and based on our history and our case investigations, it leads us that there are definitely some cases attributed to those locations. I don't have numbers to share with you at this time. This next question is from WPXI. We saw nurses and doctors get the vaccine the other day, but has it reached first responders yet?
So the prioritization of vaccines, again, is put out by the state, and we're following that guidance closely here. So I defer to the state on that.
This next question is from Public Source. Should we be unable to fully vaccinate this population as needed? What could be some of the concerns of that, particularly as they are typically, she's talking about homebound, typically at higher risk of serious complications if you're not able to get to those individuals?
Can you read that again? I'm sorry, I didn't follow that question.
Should we be unable to fully vaccinate the homebound population as needed? What could be some of the concerns of that, particularly as they are typically at higher risk of serious complications?
So we will find ways to vaccinate homebound people who want to get the vaccine, and we also will, we plan to vaccinate those who care for the homebound individuals as well. Because again, if you're homebound and your biggest risk is somebody bringing that infection to you in your home. And so we want to make sure that those who are providing home care services to those homebound individuals vaccinated as well. So that will be our approach, to vaccinate both, using all kinds of creative ways to reach people.
This next question is from the Pittsburgh Business Times. Can you talk or share anything about any public information campaign that you're going to be doing to promote the vaccine? And do you think that the successful rollout of such a campaign will help convince people who are on the fence to get the vaccine?
Working on some plans. I'm not going to share any details at this point, but I will say that people need to hear about the vaccines from those that they trust in their community. So we're definitely working with those, with lots of communities around trust in vaccines and who are the trusted individuals to deliver that message. So again, some people will trust me, but others want to hear it from their minister, their friend, their own personal physician, nurses in their community, and other people. So we're really going to rely on spread through good, knowledgeable people to share information with their communities.
And this final question is from the Tribune Review. With the restrictions currently in place, how soon do you think the Allegheny County hospitals will expect to see improvements in their capacity and the patients that they're seeing?
So in general, roughly so far, our experience has been that it takes at least 2 weeks to slow down the rate of cases after mitigation orders are put in place. And then slowly a decline after that. And then we expect there's often a delay in hospitalizations a couple weeks after that. So I don't expect to see a big change in hospitalizations for at least a couple of weeks.
That was the final question, so if there's any closing remarks.
Thank you, Dr. Bogan. I think Dr. Bogan laid it out very well. The vaccine is coming. It's here in a certain portion, and it's going to be coming. And the distribution is something that we're going to work on very diligently to get it out as quickly and to as many people, everybody really, as we can. So stay tuned. A lot of those details are still coming out. As Dr. Bogan indicated, we're expecting the Moderna vaccine to be approved this week. They'll start distributing that, and there's different methods of how it's going through some of the pharmacies to go to the long-term care facilities, nursing homes, getting it out to our first responders. It's really going to be all of us cooperating like we do on so many things in this region to make it work. The distribution, the data to keep, because often you're going to need 2 shots. You get a vaccine, and then 3 weeks or 4 weeks later, depending on it's Pfizer or Moderna, we'll need that second shot. And to keep all that information that people have. So it's going to take a great level of cooperation, but the good news is we are near the end. We are the light at the end of the tunnel. Again, orders can be put in place by the governor, by Dr. Bogan, by whoever the authority is. But the fact is, it's really up to us to cooperate and to do the things we do. We know these type of mitigating orders do work. They certainly worked in late June and early July when we saw a surge begin, when we went into the green phase. It took a couple of weeks for those numbers to start to stabilize, but we did see them stabilize and maintain relatively low for a couple of months. It's really only been for literally the last 2 months, the last 6 to 8 weeks, that we've seen these numbers go back up again. As we go to the Christmas season and the New Year, we really want to implore people to really follow the guidelines. If you are getting together, please wear your mask, be distant, stay safe, whether it's on the roads, stay off the roads because of the snow and ice, or safety in COVID. So let's continue to cooperate, continue to stay tuned as the news comes out, as the vaccine does get rolled out, and we want to get that distributed to as many people as we can. So everybody stay safe, have a good week, and we'll talk